HPV causes anogenital warts and cancer by Dr. Rick Shacket. Hi, I'm Dr. Rick Shacket, and if you've been wondering how the HPV virus causes anogenital warts and cancer, then you've come to the right place. My practice over the last 30 years have seen thousands of patients with HPV, also known as the human papillomavirus. There are more than 100 types of HPV, of which at least 13 are cancer-causing, also known as high-risk types. Once the HPV virus infects the skin, the infected skin cells begin to multiply, producing more of the human papillomavirus that can spread to nearby epithelial cells. Low-risk HPV types, which are more common, cause 90% of all anogenital warts to form, but rarely cause cancer. In contrast, high-risk HPV types, which are less common, cause 10% of all anogenital warts, but cause more than 90% of all anogenital cancers to form. Although the leading HPV vaccine is highly effective in preventing warts, the vaccine can't make your genital warts go away or stop them from reoccurring. A doctor who specializes in HPV is the one most qualified to make your genital warts go away and stop them from reoccurring. Once the HPV virus infects the skin, the infected skin cells begin to multiply, forming abnormal shapes and textures palpable on the skin surface, and eventually the virus sheds, passing to other areas of your skin and possibly to an unsuspecting partner as well. Even after a wart has been treated or removed, the viral DNA can still hide in the surrounding abnormal appearing skin, which can be a seed for new viral lesions to sprout nearby, causing reinfection. Interferon has immune modulating properties that can stop the proliferation of new viruses in nearby surrounding areas, thereby reducing the rates of reinfection. The reason to be concerned about HPV's continued presence is that virtually all causes of anal and cervical cancer are caused by HPV. Cancer caused by HPV usually starts like this. The HPV virus infects skin by attaching itself to the skin surface and binding with the cell membrane. The DNA is then injected through the cell membrane where it replicates in normal skin tissue. Slightly abnormal skin cells are then found on the skin surface. CIN1, or intraepithelial neoplasia grade 1, is not cancer and usually goes away on its own with or without treatment. However, immediate treatment can help prevent the disease from spreading. As the viral replication continues to worsen, abnormal cells can be found on the skin surface. This is sometimes called moderate dysplasia or intraepithelial neoplasia grade 2. Treatment is indicated for this condition and may include CO2 laser vaporization of wart lesions in combination with other therapies. Should the viral replication continue to worsen to the point where severely abnormal cells are found on the skin surface, this is called CIN3. CIN3 is also known as high-grade dysplasia, severe dysplasia, and carcinoma in situ. As you can see in the close-up here, the cell proliferation of CIN3 is in danger of breaking through the cell membrane and spreading. Carcinoma in situ is actually cancer cells that haven't yet broken through the skin cell membrane to become cancer. When it does break through the cell membrane, the severely dysplastic cells replicate and begin to grow out of control. This is known as cancer. To prevent cancer, the clear majority of patients in my practice receive treatment for their anogenital wart lesions. It's my experience that most patients who have remained clear of genital warts for at least 4 months continue to live a normal life for years to come without reinfection. Thank you for watching this educational video about HPV. Please be sure to give us a call at the number below this video to set up your first appointment. I look forward to treating you or your significant other. My practice over the last 30 years has seen thousands of patients with HPV, also known as the human papillomavirus. Once the HPV virus infects the skin cells begin to multiply, forming abnormal shapes and textures palpable on the skin surface, and eventually the virus sheds, passing to other areas of your skin and possibly to an unsuspecting partner as well. Worse yet, 70% or more of all the anogenital cancers are believed to be caused by HPV. Patients that see me with genital warts are embarrassed and overwhelmed. They are afraid of the stigma associated with having a sexually transmitted disease. They fear that their personal lives are going to unravel and that their partner might leave them. And rarely they are afraid of getting cancer. A big part of my practice is made up of patients who are referred to me by other physicians and whom have had little success with normal single drug therapies and little success with electrosurgery or cryofreezing in their treatment of genital wart lesions. What's more, the HPV vaccine can't make your genital warts go away once you've been infected. A big part of my practice is triple combination therapy for the treatment of genital warts. Whereas dual combination therapy has demonstrated promising results for most of my patients, triple combination therapy is even more effective. Numerous articles in medical journals have touted the benefits of combination therapies, first with topical medications applied to the surface areas of the wart and skin, second in combination with CO2 laser vaporization of the warts, and third with intralesional wart injections using interferon. Prescription topical medications like this one have been shown to be safe and effective in selected cases of anogenital warts. Like this medication, which is a natural botanical product made from an extract of green tea leaves. Carbon dioxide laser therapy is a procedure that utilizes a concentrated beam of infrared light directly target warty lesions. The special confinement of the laser beam allows for precise tissue ablation with little damage to the surrounding areas, resulting in rapid healing with minimal scar formation. One potential benefit of this treatment is that the deep penetrating effect of the laser allows for a more complete viral attack. Interferon therapy. Interferons are small, naturally occurring proteins in the human body that are produced in response to infection and other biological stimuli. Interferons exert their cellular activities by binding to specific membrane receptors on the cell surface. Once bound to the cell membrane, interferons initiate a complex sequence of intracellular events that include suppression of cell proliferation and inhibition of virus replication in virus-infected cells. An intralesional injection with interferon is easily performed by selecting an offended wart to treat. Next, a small amount of interferon is drawn up into a syringe. Then the interferon is injected just under the offending wart where the medication disperses and begins to have an effect not just on the wart but also in nearby tissue where viral replication is suppressed. This triple play effect of topical medications, CO2 laser, and interferon therapy on defeating the wart virus has benefited most of my patients, giving them the best chance to beat their HPV infection once and for all. In my practice, the results of combination therapy for the treatment of anogenital warts results in a cure rate of over 90% without remission once I've discharged that patient from my care. Although the leading HPV vaccine is highly effective in preventing warts, this vaccine can't make your genital warts go away or stop them from reoccurring. A doctor who specializes in HPV is the one most qualified to make your genital warts go away and stop them from reoccurring. Thank you for watching this educational video about HPV. Please be sure to give us a call at the number below this video to set up your first appointment. I look forward to treating you and/or your significant other.